Let's talk about vascular neurocognitive disorder. Major or mild vascular neurocognitive disorders, also known as NCD, previously referred to as cerebral vascular accidents or strokes, occur when there is a disruption of blood flow to the brain, resulting in an inadequate supply of oxygen and consequently neural cell death. There are two primary types of strokes, hemorrhagic and ischemic. In hemorrhagic strokes, there is bleeding within the brain, often from malformed blood vessels or blood vessels weakened by hypertension. Accumulated blood from leaking vessels puts pressure upon and causes damage to the surrounding brain tissue. In ischemic strokes, blood flow is obscured by the presence of thromboid, blood clots that form within blood vessels, or emboli, dislodged pieces of matter, such as blood clots, fat, or bacterial debris, within the blood vessel itself. Acute ischemic strokes are more prevalent, accounting for approximately 85% of all major or mild vascular neurocognitive disorders. The onset of a stroke is generally sudden, with symptoms appearing in less than an hour. Common stroke symptoms include unilateral weakness or paralysis in the arms or legs, facial muscle weakness or drooping, numbness, tingling or impaired sensation, changes in vision, aphasia, loss of memory, drooling or difficulty swallowing, loss of balance or coordination, vertigo, personality changes, uncontrollable eye movements, drowsiness, lethargy, or loss of consciousness, and emotional lability. In approximately 1/3 of all vascular NCDs, the stroke occurs while the individual is asleep. In these cases, the individual awakens to the experience of stroke symptoms. Symptom intensity may wax and wane, or symptoms may become increasingly severe over the course of several hours. When symptoms disappear entirely in less than 24 hours, this is referred to as a transient ischemic attack, also known as a TIA. A history of TIAs is a significant risk factor for eventually experiencing a full-blown stroke. Another risk factor for major or mild vascular NCD is increasing age. The likelihood of having a stroke doubles each decade after 45 years of age. By age 75, the probability of having a stroke is 1 to 2%. Additional risk factors include being male, using oral contraceptives, smoking, hypertension, high blood pressure, heart disease, and hypercholesterolemia, excessive cholesterol in the blood. Major or mild vascular NCD is the second most common cause of NCD after Alzheimer's disease. Prevalence rates in the U.S. range from 0.2% from ages 65 to 70 up to 16% for those over age 80. The mortality rate is approximately 1 in every 18 deaths in the United States. Only 10% of stroke victims make a full recovery, while the mortality rate is approximately 30%. Long-term effects of strokes include hemispatial neglect, dementia, seizures, speech difficulties, perceptual disturbances, depression, mood swings, impaired memory and attention, anosognosia, that is ignorance of one's own disabilities, impaired judgment, incontinence, and physical symptoms such as partial paralysis, weakness, or limited range of motion. In general, physical disabilities are resolved more quickly than are cognitive deficits. The DSM-5 uses to diagnose major and minor neurocognitive disorders with specifiers to note the cause. The difference between major and minor would come from whether or not cognitive decline from the previous level of performance was significant, major, or modest, minor, and whether the cognitive deficits interfere with their independence in everyday activities, considered major, or they do not interfere with their everyday activities, considered minor. The diagnosis of major or mild vascular neurocognitive disorder may also specify without behavioral disturbances or with behavioral disturbances and include a severity specifier of mild, moderate, or severe in reference to the ability to manage one's daily activities. Let's practice with a question from vascular neurocognitive disorder. Unilateral paralysis of the extremities, drooping eyelids, personality changes, and dementia are most characteristic of Answer A, major or mild neurocognitive disorders due to traumatic brain injuries. B, major or mild vascular neurocognitive disorders. C, major or mild neurocognitive disorders due to Parkinson's disease. Or D, major or mild neurocognitive disorders due to cerebral palsy. Answer choice B is correct, as these symptoms are more characteristic of major or mild vascular neurocognitive disorders than of major or mild neurocognitive disorders due to TBI or Parkinson's disease. Cerebral palsy is not listed under major or mild neurocognitive disorders, but also does not match the characteristics as well. Answer A is incorrect, although some of the symptoms may be present in both of the disorders. Major or mild neurocognitive disorders due to TBI may involve impaired cognitive abilities, including executive function deficits, slow speed of processing, poor attention and concentration, and fatigue. In addition, changes in physical abilities and personality often occur. Answer C is incorrect, as NCD due to Parkinson's disease is linked to the dysregulation in the production of the neurotransmitter dopamine, involved in the coordination of smooth and complex movement. Dopamine deficits result in impaired motor activity. Answer D is also incorrect. Symptoms of cerebral palsy, CP, often include the inability to perform voluntary movements, ataxia, muscle stiffness, increased muscle tone, spasticity, and awkward gait. In severe cases, CP may also be associated with increased drooling, learning disabilities, seizures, urinary and bowel problems, and hearing deficits. We invite you to participate in the next chapter of our series on the key term areas affected by the DSM-5. Thanks for joining us.